Okay, today we're going to talk about temporomandibular joint dysfunction, or also known as TMJD or TMD. I'm Brax Gabriella, and let's get started. So what is TMJD? It is an umbrella term covering both pain and dysfunction of the muscles of mastication, which are the muscles that move the jaw, and the temporomandibular joint, which is the joint that connects the mandible to the skull. So the people who are most affected by this are typically between the age of 20 and 40 years old, and it usually affects about 20 to 30% of all adults, but it is most common in females. And as I already said, it can be referred to as also TMJ, TMJ syndrome, and TMD. So some history about it. TMJD was started to first receive attention in about the 1950s. Not until the 1980s did healthcare workers actually develop a good understanding of how to diagnose the condition. As studies continued, it was actually found that there was a notable connection between arthritis and TMJD. So some anatomy about the area. The temporomandibular joint consists of 3 different articulations, which include the mandibular fossa, the articular tubercle, and the head of the mandible. But what's interesting is that none of these actually touch each other, so it makes it a very interesting joint. So as you see here, we have the articular disc right here, which separates the mandibular head from the articular tubercle and mandibular fossa, which this articular disc is actually made of fibrocartilage, and it has 2 synovial cavities which divide into right here, which keeps nothing from touching each other. So as I just said, it's a unique joint mechanism because this articular surface of the bones never come in contact with each other. And the disc splits it into 2 synovial cavities. And as you see right here, you have your superior synovial cavity, and then you have your inferior synovial cavity. Here's your head of your mandible and your mandibular fossa. The ligaments of the area include 3 different ones. You have your lateral ligament, which runs from beginning of articular tubercle to the mandibular neck, and it acts to prevent posterior dislocation. You have your sphenomandibular ligament, which the origin of that is the sphenoid spine and attaches to the mandible. And then you have your stylomandibular ligament, which supports the weight of the jaw. So here you have your lateral ligament, which prevents posterior dislocation. You have your sphenomandibular ligament, which really holds, it connects to the sphenoid spine. And then you have your stylomandibular ligament, which supports the weight of the jaw. So some causes of TMJD. You can have wear and tear on cartilage. You can have damage to surfaces of teeth due to neglect or injuries, such as getting punched in the mouth or hit in the face with a hockey puck or whatever it may be. You can have loose or lost teeth that have led to damage of the jaw. You can have poor alignment of the jaw, so your teeth would not bite down evenly, and it would lead to a dysfunction of the jaw muscles, and it would move awkwardly, essentially. You can overuse your chewing muscles. There is erosion or improper movement of the disc, the articular disc that separates the mandibular head and mandibular fossa from touching each other. You can have damage to the joint, again from neglect or injury. You can develop arthritis in the joint. You can have infections in the jaw, and you can also have tumors. Some symptoms that people complain about when they have TMJD would include pain, which includes tenderness in the jaw and aching pain in and around the ear. They would have difficulty opening the mouth fully, so they lose some of the range of motion in their jaw. They would also have difficulty or discomfort while chewing. They also sometimes complain of clicking or popping sensation that they hear every time they open or close their mouth. Sometimes they're not even able to open their mouth because the jaw just locks. It can also have headache symptoms, an uncomfortable bite, and also an uneven bite. But often it is not clear what is causing TMJ symptoms. They still are not sure exactly what causes it to happen. So some ways they diagnose TMJD is simply based on symptoms. A physical examination usually takes place, which include the following: listening and feeling the jaw of the patient opening and closing their mouth. They will check the range of motion the patient has to see if they can open their mouth fully or close it with ease or comfort. They will ask whether they've heard any popping or clicking when they open or through just any activity with their mouth. They will check their bite, which will essentially look for lost or unusual placement of teeth or any signs of grinding which can occur at night. In some cases, an X-ray or a computed tomography or a CT scan can be done to check bones of this joint. So here's an X-ray of a TMJD patient. You can see the teeth are really poorly aligned, which will eventually cause an uneven bite, which will lead to TMJD. Here's a CT scan of a patient and here's a healthy jaw. And you can see the head of the mandible is with the articular surface is very smooth, and there's good cartilage thickness over the condylar head, and this is a smooth surface it is moving against. And then a person with TMJD, you can see this is much more rigid and it's flattened out, and the head of the condyle is a lot more flattened, so the range of motion will be different and it will clearly cause pain and discomfort. So there is no widely accepted treatment protocol for TMJD, but some of the things that they do include: one is arthrocentesis, which is a procedure that flushes debris and byproducts of inflammation out of the joint. Another is correcting poor habits, and a simple example of that is correcting grinding, because sometimes when you sleep you can grind your teeth and you don't even realize, and you can have a night guard that helps control this. You can also have corrective dental treatment to fix any lost or misaligned teeth or braces or anything of that matter. They do have drugs to relieve the pain, but obviously that's just a temporary melody. They do have splints that reposition the jaw, ligaments, and muscles into better alignment to hopefully maybe fix it for good. Stress management is actually a treatment, because sometimes when you stress you can clench your jaw, or you can, without even realizing you're clenching, which can lead to TMJD. You can stretch the muscles of the jaw to maybe get more range of motion or not as tight. You can also apply hot and cold therapies to the jaw. That is my PowerPoint on TMJD. I know it was kind of brisk, but I hope you learned a lot and had some fun learning about temporomandibular joint dysfunction, and thank you so much.